Thank you for joining Let's Meet Where We Eat, conversations with innovation and entrepreneurship leaders who specialize in food and nutrition. Our series is presented by Nourish Cafe and the Food and Nutrition Innovation Institute at the Tufts Friedman School for Nutrition Science and Policy. Enjoy!
We're joined today by Stephanie Goodwin, Senior Manager, Public and Government Affairs at Danone North America. Stephanie Goodwin joined the Public and Government Affairs team at Danone North America in 2019. She's been with Danone for 8 years, first on the science team for the Division of Medical Foods, and then on the Regulatory Affairs team. Prior to joining Danone, Stephanie worked within the Office of the Assistant Secretary for Health, U.S. Department of Health and Human Services, on the 2015 Dietary Guidelines. Stephanie is a registered dietitian and earned a Master of Public Health in Health Education, as well as her doctorate in Human Nutrition and Public Policy from Virginia Tech. She completed her postdoctoral fellowship in metabolic science at the National Institute of Health with the National Institute of Diabetes and Digestive and Kidney Disease. Stephanie is also a graduate of the University of New Hampshire, where she received a Bachelor of Science in Nutritional Sciences.
Yeah, sure thing. So thanks for having me, and hello, everybody. Thank you for your introductions. Sounds like you're studying really great stuff, and I feel like before I even go into what I do, I look forward to working with you in the future. So yeah, a little bit about my background. So Stephanie Goodwin, and I started my career in nutrition at the University of New Hampshire, where I studied nutrition in the dietetics track. And I would say even right from the start, I was really interested in public health. Although we didn't have a public health program, I kept trying to do projects in like community health and things like that. Actually worked, so the Boston connection, I actually did a summer internship in Jamaica Plain for UMass Extension, working with children across the Boston area, especially in underserved areas. So thinking about actually bringing some kids out to the farms and seeing where fruits and vegetables come from, or where from other ingredients come from. We did nutrition education. I worked on the 5-a-day veggies campaign. We did some farmers market work. It was a really great summer of like just jumping in to see kind of like what the community is, what we can do in communities and really impact sort of like getting excited about eating healthy food, I would say, and knowing where your food comes from. So that was a really long time ago. But from there, I went and got matched to a dietetic internship at Virginia Tech. And I'll just say that was the intention, to be there for 1 year. And I ended up spending almost 10 years there as my career. My husband and I kind of leapfrogged each other on career opportunity. But at Virginia Tech, the dietetic internship was really great because you had the opportunity to start exploring passions, and mine just continued to be public policy. I had these great experiences of like working with children in the Boston and the inner cities, and like how can we continue to support programs like this and stuff like that. And so I started to get involved in the local dietetic association, sort of, what they were doing on policy, and even went on, I would say it was like a field trip as interns, and we went to Richmond and lobbied for some of the policies that were on, in debate for the Virginia state nutrition policy activities. And then, so that's sort of just like a background of like little snippets of, how I was involved throughout my career. But soon after my dietetic internship, I got a job with a hospital system as a clinical dietitian. But it was a really interesting position because I was put out in rural Virginia, so really close to West Virginia. And I was at what's called a critical access hospital, meaning that it's a really small hospital. I think we had 10 beds, 3 ICU beds, but huge foot traffic. So meaning people come from all over the rural area through this hospital. And I got to do some long-term care, some rehab care, outpatient dietetics, counseling and things like that, heart disease, obesity. Just I got exposed to basically, I would say, more of like the chronic disease, like what happens with poor diet, physical activity, general aging and everything like that. And I was there for about 3 years. And while I was there, I also got really involved. I continued to be really involved in our local and state dietetic association and took some leadership roles there. And just continued to, I would say, advocate in the state of Richmond for nutrition policy, and then started to dip my toes in some of the federal initiatives by the Academy of Nutrition and Dietetics as well. And anyway, long story short, I felt like the community that I was serving in rural Virginia as a dietitian, I could tell them all day, give them all sorts of tips, help them think of recipes of what to eat to make healthy dietary patterns. But at the end of the day, I didn't feel like their environment and the structure that they were living in really supported healthy dietary patterns. There was, in that area, you have a lot of coal soil, so it's not like you can go out and just plant your own fruit and vegetable garden. It's not going to grow as well. Poor access at that time. There wasn't big grocery stores or anything in the area. And so I just was like, I can't do this for the rest of my life. I had already thought I'd probably go back to graduate school anyway. And I've been working with some of the professors through my dietetic association sort of advocacy work. So I started to get to know them, and I was like, what would it look like for me to come back and do sort of like a public health nutrition degree, but with public policy? And yeah, they said, yeah, come back and do that. And so I sort of did a split degree where my degree is technically in nutrition, but I spent half my time in the public policy department and trying to link them together. And I mean, there's all sorts of things that happen in graduate school. So I won't go into all of that, but happy to answer questions later. Yeah, from there, I actually felt like if I really wanted to be able to go out and talk about nutrition, because my degree, my PhD was really more of like in the social sciences and sort of survey data. And I had this clinical nutrition experience. I wanted to have a clinical research experience. So that's why I ended up going to NIH to try to understand sort of like really, I'm not very book smart, you guys might be, but I'm not very good about like reading something in a textbook and then like knowing what that means. And so I felt like I needed to like be in it. Like, what is an RCT? What is a crossover design study? And so that's why I went to NIH to do my postdoc there. But I couldn't let go of policy, and dietary guidelines ended up opening a position, and it was right down the road from where I was already working, and got that opportunity and worked there actually with two Tufts folks, because I worked on the Dietary Guidelines Advisory Committee as a staffer for the HHS side. And as Emily mentioned, the office's assistant secretary then has a division called the Office of Disease Prevention and Health Promotion. That's what runs the dietary guidelines and the physical activity guidelines. So I was on that team. It was a great experience, but I got to work with Mim Nelson from Tufts and Tim Griffin for sustainable nutrition. So this is the 2015 dietary guidelines, and supported them and the committee as they worked on Chapter 5 for that I would say that dietary guidelines. And it was really interesting because I worked 2 years on this project of like thinking about what could sustainable nutrition look like, what could dietary guidelines look like to support sustainability. And I started to get the word from that Congress, there was folks being lobbied in Congress that they were going to cut anything mentioning sustainability from dietary guidelines, like it wouldn't be allowed. And yeah, it's super frustrating and disappointing. And during this time, I had also had my first child, and I got recruited by Danone, but the medical food side called Nutritia, to come over and work on scientific affairs, utilizing so much of my background with clinical nutrition education, things like that. But it meant that I have to probably drop policy for a little bit. So it's a really big decision. But it was also just down the road. It was 3 miles from my office, and I decided I'd always heard that the food industry was this terrible big, industry. And I thought, well, what the heck? Let's go see how bad it is. And I got, one of my roles was going to be to work on like development of product in the medical foods world. And I was like, I mean, that sounds so cool. Like, what does that even mean? So I ended up taking the role. And after 3 years in that role, I got really into the regulatory side of product development and labeling. And it's like, of course, it's back to policy. And I had been thinking so much about sort of like the science to develop policy, especially thinking dietary guidelines level. And this was really interpreting policy and regulation. And that was like a whole new world for me that I didn't even truly know that it existed. But anyway, did that for a little bit, and then So Danone or Dannon, that's probably why you know Dannon better. Dannon is the brand, the yogurt brand that was in the US for, gosh, I don't even know, like 100 years or something like that. But Dannon in 2016, I think it was, merged with a food company called White Wave Food. And so that's our plant-based side of the company. Um, think like Silk soy milk, So Delicious. They also have some other products as well. But anyway, with that merger, we tried like Dan and Wave, like to bring out both companies, but ended up going after a year or so of that to the global name, because we're a global food company, to Danone. When that merger happened, they opened up two DC positions. Our vision is one planet, one health. So thinking about, how can we make healthy food, but also by restoring the planet. And so there's two of us here in DC. One of us, not me, focuses a lot on agriculture, climate, environment, things like that. And then I focus a lot on health, so nutrition, health, food policy, and been in this role for about 4 years. And yeah, I think about like national and federal level food and nutrition policy. And probably the easiest way to think about my role is I've got three stakeholders. One is the agencies, so following and talking to, say, FDA, so like definition of healthy, for example, is going to be under me. So I'm trying to interpret that, and help the business understand what that means for us. And then USDA is another agency that I keep an eye on with SNAP, school meals, WIC, and things like that. Another stakeholder, the second one, is Congress. So I'm technically a registered lobbyist for Danone, although I would say we work with an actual lobbying agency. And it's really interesting because I always thought this would be such a bad thing to be, but I'm out here sort of advocating for the food industry, but I would say in a more progressive way than industry has done in years past, and thinking about, how could the food industry show up and support public health initiatives that maybe American Heart Association is moving forward, or CSPI, or other advocates, National WIC Association, things like that. Like, how could we help support that, but from a business side of things? And then my third group of stakeholders is trade associations. So we're on a number of those, and I represent the company there. And then I would just say informal relationships and partnerships, and food and nutrition innovation. Your group, the institute there, joining that is one part of my role. But then, yeah, informal relationships with really anyone: Academy of Nutrition and Dietetics, American Heart, American Diabetes, like really anyone who we might have alignment on topics that we could, informally think about, like, how could we support each other and work together. So let me stop there because that was a lot, but I hope that was okay. Yeah, and it's something that I just thought of, it might be really interesting for you guys to know about, and I can talk about this a little bit more. But what I didn't talk about in my background is in 2009, I did the Mirzayan Fellowship at the National Academies, with which was called at the time Institute of Medicine. It houses the Food and Nutrition Board. That's like it's a, I think it still is, but it was a 3-month fellowship where they bring scientists, engineers, medical field professionals, things like that, to DC to specifically talk about science policy or policy for science. And I would say this is where I got sort of that hands-on, because again, I really need that hands-on experience, but thinking about like what this means. And so, I mean, it's kind of obvious, but just to say it, you know, science for policy is, I think, sort of where, from a graduate school perspective, and like a lot of the stuff that I did at dietary guidelines and NIH, is thinking about like what's the knowledge or the data to support a policy moving forward, right? To help people make a decision on either creating a policy or moving a policy, or to help advocate for a policy, right? But then you have policy for science, and you can think about that, policy for science, about sort of like what policy, and a lot of this comes down to funding, supports the structure for science to be moving forward. So whether that's research and innovation, whether that's behavioral research, where is there money and structure to support that? And you have the academic structure, but there's also government structure, right? You have the National Science Foundation, you have NIH, and from a nutrition lens, often you'll hear people argue that the nutrition science doesn't get enough dollars of the research dollars. So that's also stuff that we advocate for too. But so that's just really briefly kind of the nutrition science for policy, or policy for science. And actually, I pulled a quote from, it was I think it's the past president of the National Academies of Science and Engineering, Medicine, Health and Medicine. And let me read it, because I feel really strongly about this. But it is: an ongoing global challenge is translating the wealth of scientific knowledge into solutions for human problems. Mastery of applied science and engineering, as well as mastery of the public policy process, are both essential elements of development. And it is often where you have experts in policy or experts in science, but it is rare to kind of be able to connect both of them. And you need, I think, bringing more scientists and engineers and medical professionals into the policy world is better than more lawyers, for example.